Welcome to Chamber Exchange, the TV show. My name is Tim Murray, President and CEO of the Worcester Regional Chamber of Commerce, and Chamber Exchange, the TV show, is an opportunity for us to bring on chamber member businesses and organizations or guests to talk about issues of economic development and business growth in Central Massachusetts. Very pleased to have with us in our first segment Sue Ellen Anderson Haynes, who is a registered dietitian, and Michael Haynes, who are both the Cultured Health co-founders. Well, welcome.
Thanks for having us.
Thank you. Happy to be here.
Good. So if someone wasn't aware of what cultured health is, maybe we could give a little background or tell the story.
Sure, absolutely. So Cultured Health is an app that we've founded and launched. It's a mobile app that connects dietitians to clients with matches based on culture. So each user can download the app for free. They create their own profiles. They answer a questionnaire about their culture, if you're a dietitian, a bit about your expertise. And then there's an algorithm in the background that does a matching to say, hey, based on culture, here's your highest cultural alignment. So a user can find a dietitian who is the nutrition expert, but who's also an expert in their culture, based on their background, languages spoken, religion if it impacts how they eat. So all these factors that make for a better connection. And dietitians likewise can go on and see who they match with.
Right.
And so it's essentially a matchmaking service, but enabling better health outcomes for all.
And Michael, you mentioned expert, and we have an expert between us here. Sue Ellen, you've been a dietitian for 15 years, and people talk so much in the news around healthcare. It's about healthcare, delivery and costs, and sometimes, when you're able, and people are able to actually drill down and discuss, health, elementary or most foundational to good health is good nutrition, good
Absolutely.
eating.
Mm-hmm. Right, and so as a dietitian working in the field for a little over 15 years, I came up with this idea because I've seen patients from all over the globe, and I've used interpreters along the way. And at one point, I was in a session with a particular patient, and I had to look up a particular food. As a dietitian, but also as a certified diabetes educator, we have to match particular carbohydrate with insulin. So it's really important that I know the amount of carbohydrate that they're taking. So this particular food, I didn't know if it was a carbohydrate or not. Mm-hmm. So I looked it up. It took away time from the visit. And so because it took away time from the visit, I thought that it wasn't the best outcome for the patient. It took away time, and I also was going back with the interpreter to ask, do you know the food? But the interpreter is not a food and nutrition expert. We are, right? Mm-hmm. But in actuality, dietitians are not experts in everyone's culture. So that's where the light bulb came off, and the idea came to mind that, patients deserve better health care outcomes, and they deserve time with their practitioners that is more effective. So we thought of Cultured Health as a way to match the dietitian with the client specifically based on culture. So this dietitian will know their language, speak their language, know their cultural nuances, know what particular foods they eat. So this is where we get to the next level care and where it's important for healthcare for all.
Right, right. And anyone who is a maybe foodie in Central Mass that pays attention, I mean, one of the great things about Central Mass is it's a diverse region, constant flow of immigrants, new Americans, and with that, food scenes, and people get excited about that. But to your point, if we're talking about health, it's having that kind of competency, that cultural competency and understanding of those traditions and how they influence diet and health.
Right.
Absolutely, and oftentimes, you make a great point, oftentimes folks think, well, if I want to be healthy, I can't eat my cultural foods, or I can't do this. And that's just not the case, right? Certain foods are placed in a certain category. If you have an expert who understands nutrition and your culture, they can say, well, here's how you modify how you make it, right? Based on your specific need. And dietitians, they're not just for, hey, I want to, have a goal of some sort to gain weight or lose weight, right? They also help with a lot of the, lifestyle diseases, a lot of ailments linked to nutrition. And so a lot of folks who have certain conditions, particularly in these diverse communities, that can really be addressed, largely by nutrition. The most kind of relevant, targeted care can come from the expert who gets their culture. And so we just try to facilitate those connections and provide those better outcomes.
So is the app for the public to download? Is it healthcare providers or both? Or tell us about the app and who uses it.
So the app any dietitian can download the app, and we verify the particular dietitian CDR number, making sure that they're actually a dietitian. So any dietitian from all types of cultures can download the app. We are in the United States and we're in Canada. And also clients, we connect the clients with the dietitian. Clients are anyone looking for a registered dietitian. It could be myself, even because dietitians sometimes need dietitians, but any particular person, whether it's a patient, whether it's someone that wants to improve their health, like he said, or just wants to maintain it, not just weight loss, but we work in a variety of areas, such as sports nutrition, gastrointestinal health, or women's health. So the app is there for anyone looking for a dietitian, and then dietitians of various cultures, and that spans across like the United States and to Canada.
Right, and I'll just add as well. So there are two different users, right? So two different profiles for the app. And we also, in addition to making those connections, we add other resources for each individual user. So if you're a dietitian, there are resources there about, how do I start my business and how do I think about getting credentialed with insurance companies. And we're adding more to the app for users as well. So it's, what recipes might be relevant if I'm looking at this. And so those are the two main types of users. We connect them, but we also look to provide other resources to propel their health and wellness journey.
That's what I'm saying. It sounds like you screen to make sure the dietitians are
Legit,
right?
Yes, because we want to make sure that they're getting information from the food and nutrition expert, particularly from their specific culture, right? And so dietitians spend a lot of time in school, undergrad and graduate level to maintain our professional education. And so we want to make sure that they're getting information from that particular person. And we know that nutrition lends its broad brand to prevent, manage, and also reverse certain diet and lifestyle related illnesses. So we know nutrition is very important in particular health. So we feel that connecting dietitians to clients will improve not just outcomes, but outcomes for diverse populations, specifically those at risk for certain illnesses.
Right. And so does the dietitian, certified, reviewed, make sure they're licensed, et cetera? And then the other user, Michael, would be?
The clients.
So the general public, right?
Public.
And we're also working on targeting organizations, community organizations where there are where this audience and this population, naturally kind of congregate, right? And so they're community organizations or other health organizations. We target them as well, but it's open for everyone. It's available in the app stores, Cultured Health. It's free to download and begin using. And we want to make sure folks are aware that this resource is out there for all.
I want to add, it's algorithm driven, so there's specific questions that the clients are answering to make sure that we give that perfect match. And so this is, next level care. No one is doing what we're doing currently, and we just want to spread the word because we want to help individuals on their healthcare journey. And so it's free in the app stores, and I hope everyone takes advantage of it for as soon as possible. While it is free for the dietitian, it's always going to be free for the clients, so for those looking for a dietitian.
Got it. So, again, people can, and a great idea, very much needed, and as more we learn about healthcare and people from various cultures and backgrounds, issues that affect them. And healthcare is increasingly online. Major providers, your insurance companies, pharmacies, et cetera, and you're doing that. How do they download the app store?
Sure. Yeah. So it's Apple and Android, the Google Play Store. It's Cultured Health, so Cultured, C-U-L-T-U-R-E-D, Health, and it's free to download and install. Our website, if you want to learn more about what we're doing on top of the app, is iamculturedhealth.com. So iamculturedhealth.com, and you'll get all the information there.
And we'll give the dietitian expert, the last word.
Yeah, and I would like to say that your health is your wealth, so make sure that you're taking advantage of any resources that is there to improve your health trajectory. And so Cultured Health is here to help you on your health journey, so make sure you download the app, reach out to us if you have any questions. We're happy to help.
Great. Well, great a business idea and concept, and equally as important, a great healthcare need and priority. So Ellen Anderson Haynes, a registered dietitian, and Michael Haynes from Cultured Health co-founders. Thanks for being with us and sharing with us Cultured Health.
Thank you so much.
Thanks so much, Tim.
All
Appreciate
right.
it.
We're going to come back in our next segment. Stay with us.
These days, you've got your hands full in life. That's why we help you bank simply and securely. with tools like Face ID and Touch ID. It's why we make it easy to make purchases on the go and get cash back while you're at it. Why we help you quickly deposit checks wherever you are. And it's why we lend a hand with sending and receiving money right from your phone. So even when you're on the move, you can manage your finances. Bank Hometown. Unlock your potential.